All right, we're going live. Hey, everybody, it's Cheryl Lawson. Welcome to our regular Google Plus Hangout live on air uh, for StepOne Health and, of course, Live FAQ. I know a lot of people might wonder what the banner behind me is since it doesn't say StepOne Health, but Live FAQ is where you can go and ask a question if you don't get in to ask a question while we're live. So livefaq.com if you'd like for us to answer your questions for the next Google Plus Hangout. And as usual, I have with me Mr. Gregg, who is the Director of Clinical Services, is on the team at StepOne Health. And so welcome, Gregg.
Thank you for having me on again, Cheryl. It's great to be here.
So can you describe just a little bit about what your role is on the team at StepOne Health? And, you know, we kind of have this startup vibe, and so it's great to kind of introduce the team and what you do.
Yeah, well, thank you. Well, it does have a startup vibe. However, I've been kind of in this fold with one of the principals for now almost 5 years, and so previously, we've worked through StepOne Health to deliver these direct-to-consumer services, and thankfully, I kind of got in on the service side. So me being a certified physician assistant, I'm an educator. I'm also love to essentially study the human nutrition and all the things that go into making somebody, a healthy human being. And so I love being on the service side. I've been able to participate, for again, like more than 5 years on talking to consumers about their diagnostics, preparing them for a visit with their primary care, with their specialist, helping to, sort of understand and peel away some of the mystery that comes around a lot of these diagnostics. Because, and when I say diagnostics, I'm of course talking about labs and lab markers and other things. But oftentimes these things will come to the consumer, the patient, and it's usually a paternalistic conversation from a doctor who describes things, and then they fold it up in their file and go back. And unfortunately, we as consumers and patients and individuals, we don't really know what's going on with our health, or if we did, we certainly don't remember. And so I like being on this service side and being able to describe things. Everything we do within StepOne Health and my discussions with consumers is all recorded, so they have a place to go back and say, what did he say? What was that all about? Of course, love to provide educational collateral and material, and it's a great spot to be, especially as we head into this next sort of phase of what's going on with health care in the United States and financing. Of course, it's actually a worldwide thing. The face of healthcare is changing. So it's an exciting time and a great place to be right now.
That's wonderful. Well, I mean, that really leads us into kind of the topic for today. So we're talking about the ideal healthcare environment and what that looks like, and maybe, I don't know so much how that differs, because I think we're all aware of the problems with the traditional or old healthcare system, right?
Indeed. Yeah, so that it's a great way to put it. I, of course, like to be very, very positive in the way I project, and so all I can say is what's gone on with the traditional healthcare truly is not working. So instead of saying it's bad, wrong, or otherwise, it just is a system that cannot be sustained. And quite honestly, as we go into this next phase, as I was talking about, there's not only the delivery of the health care and how many primary care physicians will be available, or primary care services, or should I say how many will be sort of taxed to the limit, because there are going to be so many people now wanting these resources, and yet we as a community, we don't have all the resources to deliver these services. And so the nice thing is we've tried to assemble a consumer destination in StepOne Health that allows people to go in, and they now have a place where they can store their information, gather information, talk to experts, get educational resources, and sort of keep that whole continuum of their health and the way they finance it and manage it for their family in one spot where they can own it and essentially make decisions that are smart and make sense for the family, and also what does well for the community and the individual as well.
Right, and I think one of the pieces that we've tried to do with this medium, and we've tried different kind of live streaming opportunities, is to connect with the online community, the tech-savvy community. We talked about the term digital health, and this, I think, speaking to an expert like yourself and some of the others that we have on our team and those that we're bringing in that we find through our research, is just another way for people to be able to connect in a way that we haven't been able to connect, I guess, in the past. And I like that, keeping it positive. So this is just an opportunity for us to engage in our own healthcare and speak to people and get access to maybe experts, maybe not even in our own areas and cities.
Yeah, no, that's absolutely right. And I mean, it's clearly evident that technology, all of that has culminated into us being individuals that are on the go using technology for just about everything we can imagine, right? Whether it's getting reservations or mapping or shopping. And at the same time, we're sensitive to look at our community to say, okay, these are well, I shouldn't say that. We know people are tech savvy to the point that they've been given that opportunity, and they're of course on all levels of the spectrum. But most people have full capability to use all of the typical point and click resources. And the nice thing is if you can give a virtual destination that is open 24 hours a day, has the right resources, keeps people safe. We have a responsibility to ensure that we're compliant with privacy laws and everything else. It's a great place for people to sort of house their stuff and be able to reach out and tap into the resources around the community and populate and learn about themselves as they start to trend this continuum over a lifetime.
Right. So how does that's a great segue into kind of where I think this discussion usually leads, and I'm glad that it is how does wellness, so we hear a lot about wellness and prevention, how does wellness fit into this new ideal environment?
Yeah, well, that's another great question, because wellness is one of these words that even folks within our own team, there are some that struggle with that term. I happen to gravitate towards it. I think it's a nice word, but wellness, of course, means something different to everybody. But at its root, I think that everybody is looking for the same thing. We want to be able to maintain our health and our well-being and that of our family. We want to do it with the most minimal expense and with the best resources and education, so we're doing it right. And oftentimes there's a disconnect between the availability to get in and see your doctor or even your nurse practitioner or physician assistant. It's very tough to actually go into physical places. But oftentimes, actually I shouldn't say oftentimes, there are times indeed when you need to go in there and actually correlate what's going on physically with what's going on, on your numbers and labs and markers and things like that. And so, we're optimally set to be able to provide people with a place where they say, okay, I just want to be well. I want to understand what I need to eat, what kind of exercises are pro-inflammatory or actually less inflammatory. Who are the people that are the experts in this field? What are the subject matter experts in advanced techniques, and looking at all the different things that go into, truly making the person, a whole, healthy individual. Because oftentimes we're sort of reacting to what we find out from the doctor. Oh, I got high cholesterol. Boy, now what do I do? And then oftentimes that may come with a script for a statin or lifestyle management and a statin. And there's all sorts of different things that will come from a reactionary engagement. But if we can be proactive and be ahead of the game and look at ourselves as individuals that we just want to keep well and healthy, we look to provide that support, whether it's through StepOne Health or all the other wonderful, resources in which people can tap and access to keep them on the straight and narrow.
So does that fall into the integrated health conversation? You talked about, my cholesterol is high, now I need to take a drug, and so that's kind of step one to step two to the end step. Is the integrated process in that description of the ideal health environment somewhere?
Yeah, it absolutely is, and the great thing is that we, again, we as a society and a community have actually welcomed more of the non-traditional health providers into the fold, and that's great news, because there's so many really wonderful, valuable resources out there, from acupuncture to holistic healers to nurse extenders and health. approach, really we as traditional providers can interact with what's going on with our acupuncturist and Chinese medicine practitioners, and we now have a great opportunity to work together, as opposed to looking down our nose and saying, well, I don't do things that way. Well, we should classically train, do it this way. Everybody has something valuable, and of course some people have things that are less valuable, and we as consumers, we kind of need to weed that out, and it's nice to have resources. I try and sort of read these things out and give that education, and of course there are many places where you can pick that up, but the story here is that indeed we are having a great opportunity for all of these resources to kind of work together and integrate, just that key word being integrative, being integrate, and bring all these things together, so the consumer really has an opportunity to look at all their options and not pick just one that has been given to them.
Right. I think it's an interesting conversation, because somebody introduced me. I have a new laptop that has Windows 8, and at first I really didn't like the little apps on my laptop, because it was apps belong on my phone and not on my computer. But there's a great app. It's called Heart 360 that connects with my Health Vault. It connects with a couple of devices, and I have my old my MedLab stuff in my Health Vault. And as I was completing my profile, I just caught myself going back to my lab results to get my latest cholesterol numbers to plug in. I'm taking my blood pressure at home for 2 or 3 days, so okay, I can plug those numbers in. And I like the idea of a one-stop shop, and is that kind of what I think StepOne Health is, with all of these numbers already in, so I don't have to go back in and start plugging in numbers, right? Yeah. Yeah,
that's one of the great things. So one of the interesting things we've done with StepOne Health and the predecessor, My MedLab, was creating a free private virtual record that any consumer gets the minute they walk in the door. And what's so great about this record is it's a truly portable, personal, private record that you as a consumer carry with you, and that means that if you're walking into a store, or you're at the ER and they say, gosh, or let's say you go to your doctor after being discharged from the ER and they say, gosh, what happened? What's the, well, I've uploaded my information, I've got it right here in my record, and you can actually show those things. Now, that's kind of a one-off case, but with respect to our traditional offerings in labs and diagnostics, we've found a great way and a technological breakthrough that allows us to take each one of the individual markers and actually put it in on what's called an individual or discrete basis in the patient's record. In that way, when they go to repeat these labs, we can actually trend and graph, or I shouldn't say we can, the consumer can. They own it, they actually go into the record and they say, gosh, here's what it was today, what was it last month? What was it a year ago? Let's push the button that accumulates those numbers and graphs it and demonstrates it, and that way you can look at an entire panel, whether it's a general health screen that's got from your glucose through your chemistries all the way down to cholesterols, and look at them side by side, or you got a couple of different numbers, and it really doesn't matter if you've added new components in or taken some out. It keeps them all the same, and it will trend the ones for which it has those data and not for the ones which it doesn't.
Right.
So hopefully that I didn't make it too complex, but it's it's very, very powerful. It allows us to do a great job of having this information for a lifetime, and that way as a consumer we can say, gosh, here's what it was back in 2014. It's now 2020, and and away we go, and we keep that for forever.
So the first step, I guess, like we just talked about, is sort of a one-stop destination for the consumer.
That's right, yeah. And some of the interesting things I might bring up as well to tease a little bit. I shouldn't say that we're just teasing. We're actually putting together the ability to have health information devices populate records, in addition to opening up some relationships with some other health services and products that are vetted and make sense, and they're not replicating what's already available out there in the market. We're really trying to be a curator of a real honest tight sort of wellness experience, I guess is the best way of putting it.
I love that. So, and then you just held up your smartphone, and so we talked about that an ideal health environment or healthcare environment is where it is customer centric and portable. So you held up your phone and said, hey, who has a question about my health? And as a consumer, you have the answers in the palm of your hand, literally.
That's right. Yeah, and it's private, and it's one of those things that you can either carry on your smartphone, on any device, or access it on a laptop, or you can even pull it up at a doctor's office if you needed to. But that your point is well taken. That this is a very special record. It's private. It gives you an added level of service. You have access anytime from anywhere. It's just a really wonderful opportunity to kind of house this information, because we've had this opportunity before where we can take information and sort of sequester it, and we say, okay, well, what were your labs? And you say, oh gosh, I'm over in whether it's Health Vault or this place or that place. You dive in there and you say, here it is, here's what they were. You're either looking at it or printing at it or looking at a PDF. Whereas with this arrangement, you have an opportunity to work with it live and actually look at the data and set it next to each other and manipulate it if you want and pull it into sheets and whatever you need to do.
Right. There was a session at the Consumer Electronics Show in January, addicted to data, and I think that the gadgets and the wearable technology that we all have is we're becoming, I don't know if addict is the right word, but in a good way, to the data that we have available to us, and having that trend, I think, is really, really critical to the consumer, because you can see, did you take steps, did you take some sort of action, whether it's a supplement or exercise or whatever it is, and then you can tell whether or not that thing that you did had an impact when you go in and do the test again, or go to get the labs at a future date, right?
Indeed, yeah. That the ability to test and retest and make sure that you are engaged with that, with sort of that continuum. It's very empowering, and really that's kind of each time that we go to speak across the country and demonstrate this value proposition in wellness communities. It's one of those things that we always lead with this empowerment, because it's the first time, or almost the first time, we as consumers actually have that empowerment, because it's we've been hamstrung for so many years, and we just kind of shrug our shoulders and go, I don't know, this guy said this, he's got the records, and you can fight, you can fight for records and keep them in your file, but the nice thing would be to have it, right there on your desktop, and ability to access it anytime, anywhere.
I know in some of our conversations we call them live results, because they are, versus a PDF file, they are live, and you can and see the data go across as you continue to find your own trends, and I personally love that.
We've talked to a lot of folks that do similar things. They say, well, we do that, we bring the labs in, but oftentimes it is going to be a graphic that's just sitting there static, and there's just really no substitute for pulling over live data that can be worked with and manipulated, and really provide that firepower and that back end. Because data is very, very important in the health community, right? Because everybody wants to understand how they can change the face of health, move the ball forward or the needle in the right direction to get people healthier, and that's great, and it's good news. But as individuals, you go, that's a nice to know. I'm glad it's out there, but what about me? How do I really take care of myself and my 4 kids and my wife and the people that are around me in my circle? It's an important thing, and it's it's one of those things that has been it just has not been evident or made itself available to us as consumers until very, very recently. And really the Affordable Health Care Act is what got this conversation stimulated and really got everybody buzzing around it. And for the last more than 10 years, there have been many initiatives on health information exchange and challenges and contests to for the people that have the best EMR and the best electronic reporting and electronic management record at the doctor's office. But all of those things serve the doctor and they serve the health community, but they very infrequently serve the individual. And I got to be honest, you and I are talking, and we're talking to a community, and we kind of care about us, and we want to make sure that we as individuals are healthy, and the rest of it, we're going in the right direction. There's a lot of strides being taken, but it's really important to make sure that we can demonstrate to the consumer how they can be empowered and take control.
Absolutely. So in the event for this hangout, I included an image, and I think you created that image, or a couple people on the team, that talked about this ideal healthcare environment that puts the consumer in the center of all of this activity, all of the practitioners and experts and their records. Talk a little bit about what that means for the consumer, and then what is the consumer centric and
sort of that experience.
Yeah.
Yeah, well, I'll tell you, I'll give you a real quick history. Back in the 1960s, there was a concept, I don't know if it was Health and Human Services or even if they were around, but anyway, the concept of a patient-centered medical home, PCMH. That was created, and really what it was designed to do, and people had identified back then that the only thing common in all of this healthcare is the person at the center. David, one of our principals, David, likes to repeat that over and over. The only thing common in your healthcare is you. And so if you place yourself at the middle of that picture, you want to be able to realize that there are all of these things that sort of feed your health status, whether it's your connected devices or assessment, what you've done as a self-assessment, the dialogue and the conversations you've had with experts, and then of course just the regular labs and diagnostics. And so all of that sort of surrounds you right at the middle, and then there's kind of a bigger circle that's got all of the other touch points, including just the traditional Western medicine and the yogis and herbalists and Chinese medicine experts and the social networks. And so we're really trying to make this a personal and comprehensive integrated model where you can start wherever you want. If you say, gosh, you know what, I'm really not into traditional medicine, I'd like to pop in here to the acupuncturist. I know one who's good, and she's wonderful. She uses whatever herbs and scents and everything else, and it gives me a great experience. But at the end of the day, I'd certainly like to know where my health markers are, because they are important. Absolutely, that's a relationship that works very well, because there's some part of that that's in the traditional space with the blood markers, and some part that's over here in more of the Eastern medicine approaches. And that again, that's a relationship that didn't used to really fluidly exist, but we're trying to make it indeed so it does with all of those touch points.
That's fantastic. That's fantastic.
Yeah.
So you talked a little bit about tracking and trending. Can you, I think that starts, we talk a lot about baseline, but where should one start in the process of creating their own data? We use the term science of you a lot. It's kind of finding out your own chemistry, and but where should the regular consumer start with finding out and beginning with their trend and their data?
Yeah, indeed. Well, interestingly, I think that my long history back, I used to be a finance guy and was in consulting and used to be a financial manager in high tech. And so I like to really look at the baseline first, is what I kind of call the balance sheet. It's just essentially your almost your inventory, which is part of the balance sheet, but it's essentially saying, okay, if we were to go in and do a baseline and we look at your fasting glucose and we look at your chemistries and maybe some other markers for what could suggest an issue with liver function or kidney function, or possibly even the way you eat, cholesterols and things like that. And so a nice baseline is sort of the first swipe through, because it kind of gives that status of where that individual is right now. They may have wonderful, impeccable genetics genetics that just gives them every opportunity in the world, in the world of, beating heart disease and inflammation and maybe great at sports. But at the end of the day, if there's something, not going appropriate within that person's life, whatever they may be feeding themselves, or a nutrient that may be ignored, that's going to demonstrate itself on that baseline. And so that baseline is kind of the first, place to get in there and say, okay, how do you feel? What's going on with you? What's your history? And what do your markers say about you? So once we got that, and we say, okay, hey, you're either perfect, you're on the straight and narrow, tell me a little bit about yourself. What do you do for exercise? How do you eat? How often do you eat? What's going on in your life? And that may be, a really, perfect human specimen that just gets to kind of just go on and maintain. But oftentimes we're not in that category. We got a little this, a little that. Sometimes I get a little heartburn. My left foot hurts a little bit. I get tired in the afternoons. There's any number of possibilities from the way people are, managing their sugars or their adrenal function, and oftentimes just a baseline, right through the door that has those essential elements that you usually get them at a yearly physical. Those elements are covered. That's a great place to start.
Wonderful. So I know that when we're talking about the ideal environment, some of that also includes, I know that there's a kind of a frustration point when people are getting overloaded with supplements and things like that, but there is a value in having a place where all of the stuff exists, where you can, get the results, speak to an expert, shop in the same location. Is that something that you would consider an ideal environment for new healthcare?
Yes and no. Here's the tough part. So you brought up, one place that it's an easy to go to, and it's actually an easy one to poke holes in, is the consumer's need and desire and want for supplements. And everybody says, gosh, what supplement do I need? What supplement do I want? Which is a good one? Which is bad? Which one is effective? Which one works? Which ones are multi-level marketing? I mean, there's all of those things that go into supplements. And so one of the, so we do have a team that is actually looking at that supplement side of things. But anything that, we do from within StepOne Health, it's very, very light as far as the push towards supplementation. Supplementation is a real, sort of a tough trick, and so it's just not one of the things that we lead with. It's really more looking at how we do things from a lifestyle standpoint initially. But oftentimes there are some nutritional deficits and some supplements that can be warranted, and those can, every now and again, they can be, the conversation can come up off that baseline, but very often we kind of have to go a little bit into some more advanced diagnostics. Nothing, when I say that, I don't mean something that's crazy imaging or something super expensive. It just means that we have to add a couple more markers, and then every now and again that even goes down to picking up a little genetic profile and looking at the genome and saying, gosh, you have, this is what it looks like on paper. You feel great. Does another test, a genetics test, explain why this marker could be showing up there? And oftentimes we find that those two kind of come together that way.
Or vice versa. You don't have the marker and you feel horrible.
Yeah, indeed.
Yeah. So we hear a lot about the quantified self. People who have all of the devices, the wearables, the Jawbones, the Fitbits, and those kind of things. How do devices and those kind of wearable technologies fit into the ideal health environment?
Yeah, devices are great. Obviously when they're warranted. Some are really, really nice devices. I mean, we've been looking at one just recently that's actually a little portable EKG that works on the iPhone. And I think you were there when we were looking at that in Tulsa just about a year ago. And what's interesting is with a device like that, very often in primary care there is a antibiotic called Zithromax, or Z-Pak is usually what people know on the street. And there's a certain population that has problems with the Z-Pak and how it interacts with their blood and thins out their blood. And if you are one of those people, it can cause sort of electrical imbalances on your EKG. And so, these little devices can be very helpful in just like from a consumer standpoint, saying, gosh, this thing has given me something that is, odd or strange. I should better go in and see my doctor. Now, oftentimes nobody's going to have that device because the doctor would have given it to them. But all the other things, the Fitbits and Jawbones, it's really, really fun to kind of add that data in there, because that again is trendable data that that makes a difference. You can kind of say, well, whether it's a Whiting scale that says I started out at 170 and over the course of time, I've gone through 160, 150. Those are really not. I mean, it sounds very simple, but those are the trending values that we need to get our arms around. And so quantifying those things, whether it being the numbers of your weight or what your blood glucose is, or any of these other sort of measurable pieces, all kind of go into that quantified self to almost give that black and white snapshot. And then we've kind of got that other side, which is, how do I feel? What's going on within my life? And that's sort of that other side of it. Right.
So we have, I don't know, not so much a question, but a hey from Joffrey Hales. Hey, thanks for tuning in, Joffrey.
Right, Joffrey.
He didn't have a question. He just wanted to say hey. So, hey, Joffrey.
Okay. I love it.
So let's talk about the integration and connection to like-minded health professionals. I know we had Regina on a couple of weeks ago talking about methylation, but how important is connecting other practitioners and experts into the fold to create this ideal environment?
Yeah, well, it's a great point, because it's a very important piece of our model, but probably the hardest one, because finding like-minded individuals, it's not so much that they're not out there, they definitely are, but making that connection, and when you sort of play in the right areas, we tend to find more of those folks around. And so we've been very fortunate to have linked up with many like-minded individuals that are in sort of this same space, saying, hey, we know that there is an ability to further wellness in the absence of traditional medical processes and medications. And I mean, there's all of these there's all these modalities that are used in traditional medicine nowadays, and some of them, of course, in an emergency situation and other very advanced situations, absolutely necessary. But there's so much that is unnecessary, from unwarranted labs and advanced diagnostics, antibiotics, statins. I mean, there's just all of these different things. Now, not to say that everybody should hear that and go, gosh, what, am I supposed to be off a statin? Absolutely not. I mean, that's a discussion for the consumer or patient with their individual healthcare provider. But my story here is, as we sort of look at new research, we're finding out that all of these medications are not without their side effect. We knew that before, but the side effects are much more pervasive and far-reaching. And there's a certain community within medicine that is starting to recognize this and understand that we need to do things different. And those are the like-minded individuals that we're reaching out to. Regina's a great example. She's just a sharp communicator, great with patients, and very wonderful as far as looking at genetic status and really understanding that that space and how to detox and what's valuable and what's less valuable. And then of course we've got multi-specialty lab providers in food intolerance and different whether it is toxic materials. I mean, there's all different things that we found with these like-minded individuals that say, yeah, we're really looking at moving the needle in the right direction and making people truly healthier and happier and feeling good, as opposed to just fulfilling the standard of care that is within traditional medicine.
I like that. I think one of the things that we've talked about before is that I'm the patient. I come to the table with my baseline numbers or with some sort of trend, and each individual will come to their experience at a different level, right? The common denominator is themselves.
Yes.
And we see a lot of people asking questions in some of the communities that we're members in. Hey, is there a doctor in my city, or do you know anybody who specializes in this in my city? And I think, how do you advise people? Is that a mindset to, maybe the person that you're looking for isn't in your hometown? It may be somebody telemedicine or virtual, or how does that fit into the ideal?
Yeah, we're finding that to be sort of a consistent tone. I mean, there are, there are a lot of people within the community that are looking for information. One of the areas that we play with in here a little bit, as you know, is the methylation space and understanding. What goes on within methylation and why it's relevant. Why there's certain people within the community that have an issue with it. And sure enough, I'm actually one of those people in the community that has an issue with it. That being said, certainly enough, we see plenty of people say, "Gosh, is there somebody in my area? I've got this. What do I do next? I've got this variant for this SNP. Now what do I do?" And absolutely, there's no substitution for a primary care encounter to make sure that you're seeing your doc and he's able to put a stethoscope on and listen and kind of correlate that physical with whatever else is going on and with your markers. But that being said, thankfully, again, being empowered individuals, we can perform virtually from wherever we are. So despite somebody who may be in a very remote area and they have a relationship with the country or the town doc, and that's totally cool. You got to keep that up. But if it's a doc that's trying to see patients and he's a very standard and general practitioner, he's probably not going to dive as deep into the methylation side. Maybe so, but my point being here, virtually these folks have an opportunity to connect with experts around the world, and of course, we're going to do our best to try and connect them with the right folks and give, again, very good, safe, reliable information that's vetted and makes a difference in lives.
Right. I think the biggest, the most important thing I think for us is that like you just said, you happen to be one of the people with the methylation marker, and one of our principals, David, always says, if you want to find somebody to help you with your problem, find a practitioner with your problem. Find somebody.
They get serious in a hurry, don't they?
Find somebody who's going through it as well, and they have the tools and research behind trying to fix it. So yeah, I think that's really a great point.
For sure.
Okay, so is there anything else you can think of from what makes the system, or what would be ideal in a new healthcare environment? I think yesterday or a couple days ago, we talked about on Twitter. I think it was a Twitter chat. We talked about healthy habits in the summertime, right? For not just for kids, but for parents, because there are certain times when the food is plentiful, the holidays back up, things kind of fall off the wagon. And, how does an integrated healthcare system help people manage those kind of peaks and valleys of their own personal health?
Well, really what you need is people engaged, and engagement's a tough thing because you can only virtually put out an electronic dashboard or destination, let's call it, and there's really nothing you can do to have whoever's accessing that engage unless you make it a game, right? Gamification, and unless they have a stake in it. And so what we try and do is really demonstrate the power of the offering to be able to bring a consumer in and essentially get a baseline and get an appraisal, a self-appraisal, make sure that the consumer is able to say, hey, here's about me, here's what I've got on paper, now what can you tell me? The next thing is it all comes down to service level. I mean, service level is key, and service level comes in a number of different areas, from how easy it is to point and click through your destination, how quick can you get to the things that you're looking for, the resources that you want. And then, of course, we have the luxury, and me being the on the clinical services side, we have a bench of professionals who actually are live and ready to talk to people. And so I often talk to my consumers who will order labs and say, gosh, I'm getting a baseline 65, or I've got this panel or that panel. I'd love to chat with someone for about 15 to 20 minutes. I want to understand what it means. I really want to get deep with it because I'm going into my doctor next week or 2 weeks from now, or for my annual physical, and I want to ask the hard-hitting questions. Or are there things that I can change outside of that from a lifestyle management, or what am I eating, what am I not, how do I work out, what's the sleep pattern? I mean, there's so many things that what I call them low-hanging fruit, because as consumers, we just don't think of the things that are healthy all the time. I mean, oftentimes we go to bed and we lay down and we go, oh, I'm going to unwind, maybe watch a little TV. Well, watching TV in bed for 30 minutes totally throws off your sleep cycle and will make a disruptive sleep. If we can correct that by eliminating TV or hot drinks in the afternoon or caffeinated beverages, and just correct people's sleep, that was a freebie, and we're on our way. People the next week say, gosh, I understand sleep hygiene now. My life is now better today than it was a week ago because of what I know. And so it really does come down to service level and meeting the consumer where they are. They need to be have these things discussed on their terms. We need to meet where they are, whether it's right here, at their desk, or live in a building. And it's really important to be able to kind of make that destination a one-stop shop that has everything you might need. And of course, one of the great things about a live destination is if there's something that you're looking for that that there isn't a great answer, you say, hey, we're going to find that out, or let's put you in touch with the right people that can get you there.
I think that's great. And so I think what you just said was really key about as the consumer, I can call you as the expert or one of the other experts within the StepOne Health family and talk to you about my results or what's happening for 15 minutes to prepare for my doctor visit, because we all know that some of those visits have become less and less time-wise valuable. You only get so much time with the doctor, and some doctors are seeing hundreds of thousands of patients
Yeah.
in a day and in a week's time. So for the doctor or the practitioner's benefit, you see a lot of stuff online that says, you don't want a customer coming in saying, they read it on the internet. But this is different. This adds some value to the doctor-patient conversation. Am I right? Or?
That's what I think, and that's what we're attempting to do. I mean, first thing, you're absolutely right. God bless these poor family doctors, because these men and women, I mean, it's a tough job. They've got to see a lot of people. There's a very, very tight time frame. I've done it. I know how difficult it is, and especially in the context of like a full physical. I mean, a full physical, the actual physical part is a very short part. Most of it is with patient education and looking at either diagnostics, patient education, questions, self-appraisals. I mean, all of that stuff makes the physical valuable. And in the absence of having that, it's very tough if you can't get to this stuff very quickly.
Mm-hmm. So I think having that discussion, that 15 minutes, a recorded call, I have some memory issues.
Yeah.
I have too many passwords and information in my head. I blame that. But some of the conversations that you might have, by the time you get to the doctor, you may have forgotten, or the thing that was bothering you a week ago is now not bothering you when you go into the office. But
Yeah.
you still want to talk about, 6 weeks ago I was feeling a little stressed out, and this is what happened. Or, this is what happened when I went on a walk. I felt some pain. You may not feel it today, but during my last walk I had some pain in my right leg. So those are the kind of things that I think, would add value to the doctor visit, so that you can get your questions out. Maybe even write them down ahead of time.
Yeah, it's absolutely right, Cheryl. One of the most important things here is, what we do as a service at StepOne, and of course many other providers, whether they're in the the traditional space or the integrative space, we're not in the business to displace a family doc or any other doc. I mean, really, there is a place for those folks, and they need to be there, and they're part of this, part of this healthcare continuum. Really, our purpose is to educate people. I mean, the fact of the matter is, a family doc or any specialist may not like you going on to the internet to try and figure out your problem. But guess what, dude? It's happening. I mean, that's just the way things are nowadays. People are. You'd almost be irresponsible if you didn't look at, at some information to just kind of understand and say, gosh, what does this mean? If nothing else, what does the word I'm looking for mean? And then, you can chat with your doctor. And of course, if you've got a very good relationship with your family doc, and one of trust, it will be a very natural conversation. They will not be, scared about you coming in with those questions, and possibly even having your own labs as well.
Okay, so I think we're almost out of time. Not quite, but I'll ask this question, and I'm speaking from personal experience about doing the thing, right? Taking the personal action or responsibility, right? So a lot of us know, we need to exercise more. We need to eliminate some things from our diets that are, probably plaguing us in one way or the other. How do you make it, or even if it's medication, how does the reminder and the tracker, how do we get people like me and others to adhere to some of the advice? Is there an ideal way for that to happen?
Yeah, there is. What's wonderful is we've had a tremendous opportunity to collaborate with some fantastic developers in the health space, and the StepOne site is very comprehensive in that way, taking all of that guesswork out and allowing for reminders to be set in place. I for example, I'm a user of bioidentical hormone, and so I have a certain schedule, and the weird thing is it's every 4 days, so I can't say, oh, it's once a week, or so I go, okay, well, Monday, Tuesday, Wednesday, Thursday. Okay, now I'm on Tuesday. So with this tracker, the great thing is I go onto my destination. I say I want a tracker for every 4 days. Here's what my bioidentical is, and I hit it. And on that 4th day, SMS message, or in this case, an iMessage comes through, and it pops up and it goes, oh, there it is. Now, if I would have forgotten that, this would be a really great reminder. And the nice thing is, it's going to hit you in the pocket wherever you are. So the tracker, or I'm sorry, the reminders, of course, is a wonderful tool. Tracking capabilities, we've built some wonderful opportunities to be able to have consumers track and trend besides what the system is doing for them. And all of these things, if you as a consumer, and you say, gosh, within my healthcare circle, here are the things that will make my life easier and make it kind of work together. We've done our best to kind of pick those off, so as you arrive at the destination, you say, gosh, yeah, I'm ready to engage and be part of this and start owning my health.
Yeah, I just set a reminder for walking, right? So I get a text message that says, hey, Cheryl, did you walk today? And you can set it for, what time do you want it to go, so that, if you're going to walk at 9 o'clock or 8 o'clock in the morning, do you want it to be 30 minutes after or 45 minutes, so you can, if you, just in case the answer is no, you can get out and go do it.
Right.
So I love the fact that there are reminders and there are trackers, right? So then if I do go for a walk, I can record in the system, yes, I did walk today, and it's more of a thumbs up for me that I can say, yeah, I really did that, as well as a reminder. I love that.
Yeah, for sure. Well, the nice thing is, I mean, all of these tools we're talking about, whether it's trackers and reminders, they're all very simple processes, and we can go buy an app for these, or I'm sure download them for free. But the nice thing is, we've tried to integrate this into one, virtual destination. And as we sort of get more robust and build this this dashboard out a little further, the ability to interconnect with devices and other professionals, and then of course, looking at, if we've got some tried and vetted supplementation that makes some sense, that will show up there as well. So we really do plan for it to be, a very Amazon-like experience, looking sort of around the clock at everything that's available.
That's fantastic. I think that is really great. Well, that's all I have for today. This was a great discussion.
Always, Cheryl, always. Yeah. Well, thank you for having me on, and I love talking about this stuff. And my passion is just, again, I love the word wellness. I don't shy away from it. I think it describes it pretty well, and so very excited about this.
Great thing. And we've been talking about doing this on a regular basis, and today all of our technology cooperated with us, so we'll certainly. The magical technology said, "Yay, you can do it." So we'll do this again, and we'll probably start talking about the experiences, right? So each of the StepOne Health opportunities, we refer to them as experiences, and so wherever the consumer wants to come in, they can. And so maybe we'll start talking about some of the experiences and maybe help some folks with some answers to help them get started with step one, right?
Yeah, I think that'll be great. I mean, the experiences, it's just to kind of add some more firepower to that word, the experiences really are sort of product groupings, and as we've developed each one of these experiences, I mean, a great example, we were just talking about sleep. Sleep is a very key issue, and so somebody may want to engage in the sleep experience. Well, what's the sleep experience? Well, it's going to have this educational collateral with these tests, with these sort of processes, and that's kind of packaged into one thing. And in each one of these, the ultimate goal is to measure, trend, and then essentially report that success. And that whole sort of that cycle is that science of you that we always relate back to.
Wonderful. Well, we'll schedule next week's session. If you have a question or would like for us to answer a question for you, either post it here in the Hangout or under the YouTube video, or you can always go to livefaq.com and ask your question there, and we'll certainly get it on. So thank you all for watching, and for future watchers, thanks so much. If you have questions, visit StepOneHealth.com. You can always find me at StepOne Health on Twitter and here on Google+. So thanks again, everybody. Have a great weekend.
Yeah, great weekend all. Bye-bye.